Hello everyone, I'm Kelly Barnett. Welcome to my channel Instant Healthcare, where I share simple tips, expert advice, and motivation to help you live a healthier, happier life. The invisible whirlpool understanding ADHD in children. Imagine a child brimming with energy, their mind racing with thoughts, flitting from one idea to the next like a butterfly in a field of flowers. This boundless energy, while seemingly charming, can sometimes mask an underlying challenge. Attention Deficit Hyperactivity Disorder, or ADHD. Affecting millions of children worldwide, ADHD is not a sign of laziness or lack of intelligence. It's a neurodevelopmental condition that affects how the brain functions, particularly in areas related to attention, impulse control, and activity levels. Imagine a whirlpool, swirling invisibly beneath the surface. That's ADHD. Children with ADHD often struggle to sit still, focus on tasks, and control their impulses. They may fidget, interrupt conversations, or blurt out answers before thinking. These behaviors, while challenging, are not intentional acts of defiance. They are expressions of a brain wired differently, yearning for understanding and support. Just as we wouldn't fault a child for needing glasses to see clearly, we must approach ADHD with empathy and a commitment to providing the right tools for success. Telltale signs. Common symptoms of ADHD in children. ADHD manifests itself in a myriad of ways, and no two children will experience it identically. Each child is unique, and their symptoms can vary widely, making it essential to understand the broad spectrum of behaviors associated with ADHD. However, there are some common telltale signs that can help parents and educators identify potential cases. Recognizing these signs early can lead to timely interventions and support. One of the hallmark symptoms is inattentiveness. This can often be mistaken for daydreaming or a lack of interest, but it goes much deeper. Children with ADHD may struggle to pay attention to details, make careless mistakes in schoolwork, or seem easily distracted by external stimuli. They might find it hard to follow through on instructions or complete tasks. Imagine a child trying to assemble a puzzle while a lively cartoon plays on the television nearby. The allure of the flashing images and catchy tunes can easily derail their focus. This constant battle for attention can be exhausting for both the child and those around them. Another prominent symptom cluster revolves around hyperactivity and impulsivity. These behaviors are often more noticeable and can be more disruptive in structured settings. Children with ADHD may find it incredibly difficult to sit still, often fidgeting, squirming, or even running and climbing excessively in inappropriate situations. This restlessness can be misinterpreted as misbehavior or defiance. Picture a child in a library, unable to contain their energy, whispering loudly and tapping their feet incessantly, disrupting the quiet atmosphere. Such scenarios highlight the challenges these children face in environments that demand calm and quiet. Impulsivity, another facet of this symptom cluster, can manifest as interrupting others frequently, blurting out answers before questions are completed, or difficulty waiting their turn in games or activities. This impulsiveness can lead to social challenges and misunderstandings. These symptoms, while challenging, are not insurmountable obstacles. With the right strategies and support, children with ADHD can learn to manage their symptoms effectively. With early identification, appropriate interventions, and a supportive environment, children with ADHD can thrive and reach their full potential. This support can come from parents, teachers, and healthcare professionals working together. Remember, behind those seemingly disruptive behaviors lies a child yearning to learn, connect, and succeed. They have the same dreams and aspirations as their peers. By understanding the symptoms and providing the right support, we can help them navigate the world with confidence and resilience. Every child deserves the chance to shine, and with our help, they can. A day in the life: how ADHD impacts a child's world. To truly understand ADHD, we must step into the shoes of a child navigating the world with this condition. It's a journey filled with unique challenges and unexpected moments of joy. Imagine waking up feeling like a tightly wound spring, ready to burst with energy. Every morning starts with a surge of enthusiasm that can be both exhilarating and overwhelming. Breakfast becomes a blur of spilled cereal and half-eaten toast, as your mind races with anticipation for the day ahead. The simplest tasks can turn into chaotic adventures. At school, the struggle to sit still and focus during lessons feels like an impossible task. The classroom environment, with its rigid structure, can be particularly challenging. The teacher's voice fades into a monotonous drone, as your gaze drifts towards the vibrant posters on the classroom walls, your mind conjuring up fantastical stories inspired by the images. It's a constant battle between imagination and reality. Social interactions can also present unique challenges for children with ADHD. The playground, a place of fun for many, can become a minefield of social cues and unspoken rules. Imagine wanting desperately to join a game on the playground, but struggling to wait your turn, blurting out strategies, and accidentally breaking the rules in your excitement. This can lead to misunderstandings and unintentional conflicts. These impulsive actions, while unintentional, can lead to misunderstandings, frustration, and feelings of isolation. The desire to connect is there, but the execution often falls short. At home, completing homework assignments feels like climbing Mount Everest. The sheer volume of tasks can be daunting, and the pressure to perform can be overwhelming. Distractions lurk around every corner. The allure of a favorite toy, the tempting sounds of siblings playing outside, or the constant buzzing of notifications on a nearby electronic device. Concentration becomes a rare commodity. It's important to remember that every child with ADHD experiences the world in their own unique way. Their perspectives are as varied as their personalities. Some may excel in creative endeavors, their boundless energy fueling imaginative projects and artistic expressions. Their creativity knows no bounds. Others may possess a remarkable ability to hyper-focus on activities that deeply interest them, spending hours engrossed in building elaborate Lego structures or mastering complex video games. This intense focus can be a double-edged sword. By recognizing the diverse ways ADHD manifests itself, we can tailor our approach to support each child's individual strengths and needs. Understanding and empathy are key to helping them thrive in their own unique way. Section 4. Beyond the obvious, unmasking the lesser-known symptoms. While inattentiveness, hyperactivity, and impulsivity take center stage in discussions about ADHD, it's crucial to recognize that this complex condition encompasses a wider spectrum of symptoms, some of which often go unnoticed or misunderstood. These symptoms can be subtle, yet they profoundly affect the lives of those who experience them. These invisible symptoms can significantly impact a child's emotional well-being, social interactions, and overall quality of life. They can lead to feelings of isolation and misunderstanding, as the child struggles to cope with emotions that seem overwhelming and unmanageable. One such symptom is emotional dysregulation, a heightened sensitivity to emotional stimuli that can lead to exaggerated reactions, frequent mood swings, and difficulty regulating feelings of frustration, anger, or sadness. This can make everyday situations feel like insurmountable challenges. Imagine a child bursting into tears because their favorite crayon broke, their emotional response seemingly disproportionate to the situation. This is not just a simple overreaction. It is a manifestation of their struggle to control and process their emotions effectively. This heightened sensitivity stems from difficulty modulating emotional responses, making it challenging for them to navigate the ups and downs of daily life without feeling overwhelmed. Everyday tasks and interactions can become sources of significant stress and anxiety. Another lesser-known symptom is rejection-sensitive dysphoria, or RSD, an intense emotional pain and sensitivity to perceived or actual rejection or criticism. This can make social interactions particularly daunting and fraught with anxiety. Children with RSD may experience extreme emotional distress in social situations, fearing judgment or disapproval from their peers. This fear can lead to avoidance of social interactions, further isolating the child and exacerbating feelings of loneliness. A simple comment like, "That's not how you play the game," can send a child with RSD into a spiral of self-doubt and negative self-talk, leading them to withdraw from social interactions altogether. This withdrawal can hinder their social development and create a cycle of fear and avoidance. Furthermore, ADHD often coexists with other mental health conditions such as anxiety and depression. The interplay between these conditions can complicate diagnosis and treatment, making it essential to address all aspects of a child's mental health. The constant struggle to meet expectations, social challenges, and emotional dysregulation can take a toll on a child's mental well-being, increasing their risk of developing anxiety disorders or experiencing symptoms of depression. Early intervention and comprehensive support are crucial in helping these children navigate their complex emotional landscapes and lead fulfilling lives. Section 5. Early intervention, the key to unlocking potential. Early intervention is paramount when it comes to supporting children with ADHD and helping them thrive. Just as a gardener tends to a delicate seedling, providing it with the right nutrients, sunlight, and care, So too must we nurture the developing minds and emotional well-being of children navigating the challenges of ADHD. Recognizing the signs early on and seeking professional help is crucial in unlocking their full potential and empowering them to lead fulfilling lives. When we intervene early, we provide children with the tools and strategies they need to manage their symptoms, build self-esteem, and develop coping mechanisms that will serve them well throughout their lives. Early intervention typically involves a multidisciplinary approach, encompassing assessments and interventions tailored to the child's unique needs. This may include educational support, behavioral therapy, parent training, and in some cases, medication. The earlier we intervene, the better equipped children with ADHD will be to navigate the challenges they face, both in the classroom and in their social lives. Early intervention is not about fixing children with ADHD. It's about understanding their unique neurodiversity and providing them with the support and guidance they need to flourish. Remember, early intervention is an investment in a child's future, paving the way for a brighter tomorrow.